Good morning, ladies and gentlemen. First of all, I wanted to thank Estefania and her team for giving us the opportunity to be here, because I think it is a huge achievement and it opens up new opportunities to be able to debate and speak about such an important topic. So congratulations for all this to you, Estefania, and to your whole team. After these words of acknowledgement, I also wanted to say that being here from the state level on health and safety is important, because it acknowledges our duty, i.e. thinking globally and acting locally. And that's why I think that being here in this parliament is the first step, because it enables us to think globally about such an important topic that is cannabis, in order to apply our conclusions at the local level, at the different states, the different regions, the different collectivities and the different municipalities. And I think that it is a political work, a political know-how that is very important. Today we are going to speak about the possible regulation on cannabis. As Estefania said, we are going to speak about the different perspectives of cannabis, and this is very interesting, of course. We are going to speak about the health perspective, the health aspects, and then we are going to speak about the possible development of our regions, of some villages, because we want to foster rural development and the economic impact of these new production models. And we are going to intertwine those three topics so that we can have a better footprint, and so that we can have a better knowledge. I'm going to focus on medicinal uses and therapeutical uses. And to do so, I'm going to speak about I'm going to divide my presentation in three chapters. First, what would be the medicinal use? Secondly, what are the health and safety policies and the regulations? And then a series of conclusions and recommendations. So to give you a background of the medicinal use, I think that we have to be very honest about the potential uses of cannabis, and also the limitations. We need to be very honest and balance the different potentials. And we all know that there is a real therapeutical use to cannabis. We cannot deny it, and there are enough proofs, scientific proof, even for those who often have a neoliberal perspective, and everyone acknowledges the therapeutical positive uses of cannabis. And so we have to know how this plant has such medicinal potential. And if we look back at the history of the plant and its uses, hundreds of years ago, cannabis was already used as a medicinal plant. Because for many, many years, for many centuries, the medicinal plants were used, and botany was very important, and it was done in link with medicine. And so I would like to give you a few information on the medicinal uses of cannabis as a plant. It contains different active principles, the cannabinoids, and the THC, and the tetrahydrocannabidiol, and cannabidiol. These are two active principles, and it is important to know that, because it helps better draft the public policies. The THC has a series of receptors, and it can influence at the cell level. It can have different influences. And you have the CB1 receptor, which has a direct link with the nervous system, and the CB2 receptor that has an effect on the immune system, so anti-inflammatory aspects. And it also acts through alternative mechanisms, and it has anti-inflammatory factors, and it also helps to reduce some psychoactive effects that are unwanted, of course. And it is very interesting because it helps us better understand what are the regulatory possibilities. It is important to understand the types of components and active factors that are present in the plant. So we need to have a balanced composition between the THC and the CBD according to the kind of pathologies we want to treat. And as we just said, it depends on the how the plant is grown and how the extraction and the extraction method that is used. And these two elements should also be taken into account in a good public policy. It is fundamental for us to know the THC composition and the CBD composition. And we need to make sure that there are no heavy metals on the plant and that there are no pesticides, of course. And so we need to have a global policy that would take into account the different aspects. And so we need a public policy that takes into that is similar to the agro-food policies. So we need a policy that takes into account the different aspects of the production model, like the agro-food business. It should be similar to the policies that are used for the consumption of food. We are going to listen to different testimonies on the possible uses. Very briefly, I'm going to mention some of these uses. It can be used for the symptomatic treatment of some diseases, i.e. cannabis can alleviate some symptoms. It cannot cure diseases as such, but it can help overcome some unwanted effects. And in that sense, we can use it for the symptomatic treatment of different types of chronic pain or motor movements related to MS, or even help reduce the pain of advanced HIV/AIDS disease. It helps also to reduce the effects of convulsions, epilepsy, and seizures. And I also wanted to speak about the different position of the states vis-à-vis the treatment of chronic pain and chronic diseases. Different drugs were created. They all derive from opiates, like morphine. And curiously, they have unwanted secondary effect on the body, on the organism. And so this should be a warning sign, because it shows that the drug isn't being used properly. Opioids have lots of secondary effects, and this should be a good enough reason to promote medicinal cannabis, because we know that currently we have drugs that were approved by the FDA and the EMEA, the American Food and Drug Administration, and the European Administration, where drugs that have cannabis components, cannabinoid components. And if we use them with Marinol or Satinex, well-known drugs, then some complications can appear. Because there's a single ratio 1:1 between THC and CB1, and this is something important. The price is very high. For instance, in Spain, a treatment with one of these two components, or Marinol or Satives, can cost up to 500 euros for a 2 or 3 week treatment. So it is clear that if we want to alleviate chronic pain, we have to think about different alternatives. There's a more healthy and more cheaper way that would be medicinal cannabis, because medicinal cannabis has a better balance of the different chemical products. There are different chemotypes in the plant, different kinds of preparations, and the cost of production is much more appropriate to have a sustainable health system compared with other drugs. That was the first part of my presentation, so what would be the medicinal uses of cannabis, and now I'm going to speak about the different policies, the public health policies in relation with a possible regulation. I'm going to speak about the different uses of cannabis. There are different uses, that's true, and they should be taken into account in public health policies. We should be able to analyze the different legalization options for medicinal cannabis, but also for the other uses of cannabis. I'm going to quote the British Medical Journal that said the following: proof and ethics have to foster policies that are going to promote health and respect dignity. We all know the collateral effects of destructive policies or policies to forbid some products. We know that the collateral effects are bad, and they always affect the same people: women, marginalized population, and poor populations. In that sense, I would like to mention something that my colleagues might develop furthermore. When we want to speak about the effects of public policies, we need to be able to go against mainstream speeches on the war on drugs. It is very important to speak about that, because we know that there are very devious effects of these war on drug policies. They create a real war against drugs. There are several studies that show the negative impacts. Johan Hadi published a very interesting book on the history of the policies of the war on drugs, and they show the different dimensions of that problem, because they mix everything: the medicinal use, the production modes, the drug trafficking, the policies, and in the book it shows that before 1914 you could buy in any pharmacy the drugs with the cocaine and heroin, and even Coca-Cola, the drink, was produced with cocaine leaves, but people weren't addicts. And it shows the negative effects and the negative impacts on health of the criminalization of some products. With the criminalization came the development of illegal markets and the excessive use of those products that led to overdoses, because the available products weren't of sufficient quality, and this led to criminality, of course. And also the fact that some way or another the illegal drug trafficking also has huge consequences on the economy of a country. That's why it is very difficult. Narco trafficking, drug trafficking means a lot of money for the traffickers, and so it is very difficult to put an end to it. And in that sense, I think that we need to be quite clear, because we know that drugs can lead to addiction. And I know that there are many voices against the legalization of the medicinal use and also the leisure use. The recreational use. You have to take into account that for addiction there are different factors explaining the addiction. It's not only the product. You have to take into account the social outsourcing, for instance. Several studies show that Indian people in US reserves were kicked off of their own lands and they were put into reserves, and it increased the rate of chronic alcoholism. And there are also some people that are more subject to addiction because with your background or with your history, you have more or less opportunities to fall into an addictive pattern. So we need to see the possibilities of the legalization of recreational use, and you have to make an analysis of the socio-political and socio-economical aspects. And we need to take into account the consequences on public health. And if you want to take into account the general framework of public policy, you also need to take into account different elements and have the possibility of carrying out studies, taking into account different issues. For instance, we need to mobilize all involved communities in order to make sure that the public policies that will be drafted will be monitored and will be analyzed by relevant people. We need to have a legal framework that is not going to exclude any stakeholder. We need to go against the war against drugs. We need to adopt a more positive outlook and not always have this catastrophe perspective. We need to consider those people as phytosanitary agents because they are part of the communities, and we need to also foster investigation, information, dissemination. There are different data available, and these are very interesting, that show that legalizing the consumption of marijuana is not going to increase the recreational use amongst teenagers. And there's also a very interesting article of the New England magazine. It was published in 2015. There was a very serious studies that were carried out on the recreational use of teenagers, and in the state of Colorado in the United States. The use, the therapeutical use was legalized in 2000 and recreational use was legalized in 2014. I hope we won't need 14 years to do the same, but they carried out different investigations. They tried to see what would be the impacts on public health. They also wanted to be a reference point so that if other states wanted to adopt the same policy, they could use them as an example. And so there was a study on the use of the teenagers' use of cannabis or marijuana. Once the product was legalized, once the medicinal and recreational uses were legalized, the consumption didn't increase. The number of teenagers consuming marijuana or cannabis didn't go to the roof. And so this is very important. However, the study shows that in Colorado, in the state, because THC has a psychoactive effect, there was a slight increase of car crashes. And so they decided to limit the level of THC in legalized cannabis. But it's about the same issue as with alcohol consumption. So there was a slight increase of car incidents, car crashes, and so this was the one impact on public health that was mentioned in the study. And so this Colorado investigation is a classic study, and it can be an example. And even the American Journal of Public Health mentioned the investigation and also says that we need to study the different potential impacts on health. First, we need to assess and monitor the consumption patterns, and we also need to be careful with the populations at risk. So we need to have an assessment process, a monitoring process, a very serious process to follow up the at-risk population, i.e. the teenagers or marginalized people. And we need to develop public policies, relevant public policies with education chapters in order to raise awareness. I think that education is a fundamental pillar so that afterwards we can be more responsible and free. Freedom comes with responsibility, otherwise it's impossible. And we need to work on that, on the relationship between freedom and responsibility. This is undeniable. And if we want to develop public policies, of course, we need to cooperate, we need to collaborate with the different sectors, and we need to include the community associations and the different stakeholders that have to be gathered around the same table. We need to include all the different stakeholders, otherwise we won't manage to have relevant public policies. And to conclude with my conclusions, I'm going to be quite quick because I think that some of my colleagues are going to speak more about the current situation. And given the high number of countries who've legalized medicinal cannabis, the UN also acknowledged the international legality of these legalization programs. And international agencies explicitly said in their report that we cannot criminalize the cannabis because cannabis cannot be considered as a hard drug. In 1961, there was a study on the single convention in order to open up the door to legalization. And recently, in April 2016, there was a General Assembly of the UN on drugs in the world. And the participants decided to work together in order to fight together against the global problem that is the drugs, and to develop and apply national policies according to their needs and their priorities. In Spain, in 1961, the country ratified the UN conventions on drugs that was adopted in 1961, and in 1967 they updated the regulations and the laws on narcotics. In 2014, a decree proposal was presented in Parliament. It's not a bill, it's a decree proposal, but we are in a kind of limbo because there were some government changes, and there was a proposed decree in order to review the medicinal use of cannabis. It wouldn't be as complicated as it might seem, because we want to legalize the medicinal use of cannabis. And so the door is now open. Everything is not done yet. We haven't reached a full legalization of the recreational and medicinal use of cannabis, but the door is now open. So what can we do? When can we really make the final steps in order to go ahead? And to conclude, in Unidos Podemos, we want to really support wholeheartedly all the communities that have been working for years and years on the legalization of medicinal and recreational use, and support them in their work. We need to carry out studies to help us in that work. And work with the different civil society organizations that have been working on that. And medicinal use has to be legalized in order to help the people who need that. And this would be a first step towards the legalization of recreational use, hoping that the state will not keep its paternalistic position. Thank you.